What are the HIV questions you're secretly Googling? We decided to find out. When you're trying to get information online, it can be really hard to separate fact from fear. The internet is a minefield of conflicting advice, old information, and just plain dangerous myths. So we dived into the search data to find the 10 biggest questions people are asking about HIV, and what we found might surprise you. From myths about how you can get it to the truth about what it's really like to live with HIV today, there's just so much fear and misinformation out there. That's why we're here, to give you the clear, factual answers you've been looking for. Our goal is that by the end of this video, you have the truth, because this is a conversation that literally saves lives. All right, let's get right to it. The first and most common question people are asking is a big one. What is the difference between HIV and AIDS? This is probably the most important thing to understand. HIV, that's human immunodeficiency virus, is the virus itself. Think of it as the cause. It attacks your immune system, specifically a type of white blood cell called CD4 cell. Now, AIDS, acquired immunodeficiency syndrome, isn't a virus. It's a diagnosis. It's what we call the most advanced stage of an HIV infection. You get an AIDS diagnosis when your immune system is severely damaged, which we can tell by a very low number of those CD4 cells, or if you develop certain specific infections. Before we had the treatments we have now, someone with HIV might have progressed to AIDS in about 8 to 10 years. Today, with effective treatment, most people with HIV will never get AIDS. So having HIV doesn't mean you have AIDS or that you'll even get it, especially with modern medicine. That's a huge clarification. And that leads right into the next question people have. Question 2, how is HIV diagnosed and staged? HIV is mostly diagnosed with tests that look for it in your blood or saliva. The most common kind are antigen antibody tests, and they can usually detect the virus within a few weeks of exposure. There are also other tests like nucleic acid tests or NATS that can find the virus even sooner, but they aren't used as often for initial screening. Once someone has a diagnosis, the infection is staged to see how far it's progressed. To do this, we look at 2 key numbers: your CD4 cell count, which tells us how healthy your immune system is, and your viral load, which is the amount of HIV in your blood. The goal of treatment is always a high CD4 count and a low viral load. These numbers tell us if the treatment is working. That makes total sense. So it's all about keeping track of those numbers, and that connects directly to the next big worry people are searching for. Question 3, how quickly does HIV progress to AIDS? This is where we really see the power of modern medicine. Without any treatment, it might take about a decade to progress to AIDS, but that varies a lot. With today's treatment, though, that progression can be stopped completely. Someone who starts and stays on their antiretroviral therapy, or ART, can keep their HIV from ever becoming AIDS. The whole point of the treatment is to suppress the virus so well that the immune system stays strong. For people on successful treatment, progressing to AIDS just isn't something we expect to happen anymore. That's incredible. And that treatment is exactly what our audience wants to know about next. Now, if you are getting value from this video, please like it, share it within your network, and don't forget to subscribe so you can be notified when new informative content like this is published. Question 4, what are the main treatments for HIV? The main treatment for HIV is called antiretroviral therapy, or ART. It isn't a single drug, but a combination of medicines that work together to stop the virus from making copies of itself. When you stop the virus from replicating, the immune system has a chance to recover and do its job. Today, for a lot of people, treatment is as simple as a single pill once a day. We also have newer, long-acting injectable treatments that you can get once every month or 2. Which is a fantastic option for anyone who has trouble with daily pills. These treatments are amazingly effective. 1 pill a day is a world away from the complicated treatments of the past. It sounds so much more manageable. And this leads to what might be the most hopeful question on our list. Question 5, can people with HIV live long, healthy lives? Yes, 1,000 times. Yes. A person with HIV who has access to and stays on their treatment can expect to live a normal lifespan. We now look at HIV as a manageable chronic condition. not a death sentence. A young person diagnosed with HIV today who starts their treatment can expect to live well into their 70s or 80s. And there's more good news. When treatment lowers the amount of HIV in the blood so much that a standard lab test can't find it, we call this being undetectable. And when you're undetectable, you cannot sexually transmit the virus to a partner. This is a scientific fact, and it's the basis of the global U equals U campaign. Undetectable equals untransmittable. This has completely changed what it means to live and love with HIV. U equals U. That feels like a game changer for finally breaking down stigma. But the myths are still out there, which brings us to our next question. Question 6. What are some common myths about HIV transmission? This is so critical because these myths create so much unnecessary fear. Let's be crystal clear. You do not get HIV from casual everyday contact. You can't get it from hugging, shaking hands, sharing toilets, sharing dishes, or from bug bites. The virus just doesn't survive outside the body for long, and you can't get it through the air or in water. HIV is only transmitted through very specific body fluids: blood, semen, vaginal fluids, rectal fluids, and breast milk. And for transmission to even happen, one of those fluids has to come into contact with a mucous membrane, like in the mouth or genitals, or get directly into the bloodstream. That really puts the actual risk into perspective. And it helps debunk a harmful stereotype that's been around for decades, which is what this next question is about. Question 7, is HIV only a gay disease? Absolutely not. That is a dangerous and deeply outdated myth. HIV doesn't care about your sexual orientation, your gender, or who you are. Anyone can get HIV. While some groups, like men who have sex with men, are more affected due to a mix of factors, a huge number of new infections around the world happen through heterosexual contact. Your risk is about your behaviors, like having sex without a condom or sharing needles, not about your identity. Behavior, not identity. That's such a crucial message. Now let's get into some of the more specific medical questions people are asking. Question 8, what is advanced HIV disease? Advanced HIV disease, or AHD, is a specific term we use when someone's immune system has become very weak. The World Health Organization defines it as having a CD4 count below 200, or having a serious illness related to HIV, like tuberculosis. It's also important to know that all children under 5 with HIV are considered to have AHD. Their immune systems are still developing, which puts them at a really high risk of getting sick very quickly. People with AHD are incredibly vulnerable to life-threatening infections. That sounds incredibly serious, and it leads us right to our 9th question. Question 9. What are the key opportunistic infections in advanced HIV? Opportunistic infections are illnesses that basically take advantage of a weak immune system. For people with advanced HIV, the most common and dangerous ones are tuberculosis, TB, and something called cryptococcal meningitis, which is a severe fungal infection in the brain. We also see serious bacterial infections and certain cancers. These infections are what cause severe illness and death in people with advanced HIV. This is exactly why it's so critical to get diagnosed with HIV early and start treatment. It just really highlights why getting tested is so important. And now for our final question, the one that holds so much hope. Question 10. Can HIV infection be reversed or cured? This is the ultimate goal, isn't it? Right now, there is no widely available cure for HIV, but there is so much hope on the horizon. We have a small handful of documented cases where people have been functionally cured, meaning the virus is gone from their system without daily medication, usually after intense procedures like bone marrow transplants. Scientists are exploring so many exciting ideas, from gene editing with tools like CRISPR to therapeutic vaccines. While we're not there yet for everyone, the progress in cure research is moving faster than ever before. For now, the key is sticking to that antiretroviral therapy, which controls the virus so you can live a long, healthy life. For everyone watching, if you found this information valuable, please take a second to like this video and subscribe. And more importantly, share it. Every single share is a way to fight stigma with facts. And it might just be the one thing someone in your life desperately needs to see. We'll also put links to resources for testing and support in the description below. As we wrap up, there's one single message we want you to walk away with today. Knowledge defeats fear. HIV is not the terrifying diagnosis it used to be. With treatment, people can live long, happy lives, and they can be certain they won't pass the virus to their partners. So get tested. Know your status. If you're living with HIV, know that you can thrive. And if you're HIV negative, know how to protect yourself and how to support the people around you without judgment. The fight against HIV isn't just about medicine. It's about knowledge, compassion, and understanding. Thank you all for watching.